SA Pharmacy has a statewide medicines information service, responding to over 10,000 inquiries each year. These inquiries come from patients, pharmacists, doctors, nurses, and other healthcare professionals. We have the skills to locate, interpret, and apply evidence-based information. This enables us to provide tailored advice on the use of medicines in children, adults, and women who are pregnant or breastfeeding. Questions range from general medicine inquiries to specialised areas such as mental health, heart, kidney, and liver disease.
It's really hard to know what to trust on the internet, and so it's great to be able to ring through and speak to a real pharmacist who's able to give you relevant advice. Medicines information also can direct me to websites that have been put together by healthcare professionals. It's quite useful to get some extra information.
Medicines information services really help us as community pharmacists because it provides us with non-biased, evidence-based information that is most up to date.
They can provide really useful information regarding the patient when provided in the right context. And they do this in a clinically relevant time frame.
The Medicines Information Service provides teaching and training for healthcare professionals. We also provide resources to support healthcare professionals in their day-to-day practice. An example being our dedicated Medicines Information website. Research is another exciting role within the Medicines Information, where our staff identify knowledge gaps and design research projects to inform practice. For example, our pharmacists work with breastfeeding mothers to measure the amount of medicines passing into breast milk, for which there is currently very limited information.
There's lots of areas that we don't have a lot of information about, particularly in our patient population, so that's children and pregnant women and breastfeeding women. And with that, it's very hard to make really good treatment decisions for those patients. So research plays a really important role in trying to gather more information.
What I find most rewarding about my job is being able to make a difference into patients' care. I remember the first time I talked to a woman who was worried about the medication she was taking before she knew she was pregnant. She read online that it could be harmful for the baby. I was able to provide her with information and reassure any doubts, and she was really grateful that I was able to put her mind at ease.
I first received my training in my intern year, and I quickly noticed how useful it was. I had doctors and nurses, for example, come up to me and have questions, and I was able to use those resources I'd learnt about to be able to apply it to individual patients.
Most of the inquiries that we get asked are about a specific patient, so it's really rewarding to be able to provide that evidence-based input to guide decisions for that patient.
Medicines information is an exciting and dynamic area, exploring new ways to use technology to communicate information. Opportunities for hospital pharmacy interns include attending a training seminar and undertaking a 4-week placement. Registered pharmacists can also apply for a 6-month training position. For questions about medicines information, contact SA Pharmacy.